Let's talk knees for a minute. If you're anywhere past 50, chances are your knees have already tried to tell you something. A twinge going down the stairs, a dull ache after sitting too long, that little crack when you stand up from the couch. You're not broken. You're not just getting old in some hopeless way. Most of the time, cranky knees are simply asking for a bit of attention. Some gentle movement, a little strength, and a bit less stiffness sitting around unused. So here's the deal. I'm going to walk you through one simple exercise a day for 7 days. Nothing fancy, nothing that requires a gym membership or a physical therapy degree. Just movements you can do in your living room in about 10 minutes in your regular clothes. Ready? Let's go day by day. Day 1. Seated knee extensions. We're starting easy on purpose. Grab a sturdy chair, one where your feet touch the floor comfortably. Sit toward the front edge, back straight but relaxed, hands resting on your thighs or the sides of the chair. Now slowly straighten one leg out in front of you until it's as level as it comfortably gets. Hold it there for about 3 seconds. You'll feel the muscle right above your kneecap working. That's the quadriceps, and it's basically your knee's best friend. It supports the joint, absorbs shock, and when it's strong, your knee doesn't have to work as hard on its own. Lower the leg back down slowly. Don't just drop it. Do 10 reps on one leg, then switch. Why start here? Because this move builds strength without putting any weight through the joint. No pounding, no twisting, just controlled muscle work. If 10 reps feels like too much on day 1, do 5. This isn't a competition with yourself. It's a conversation with your body, and today you're just saying hello. Day 2. Wall sits. Find a clear stretch of wall. Stand with your back against it, feet shoulder width apart and a little forward. Maybe 6 inches out from the wall. Now slide down slightly, like you're about to sit in an invisible chair, but only go a small amount. We are not talking about a deep squat here. Even a few inches down is plenty for day 2. Hold that position for 10 to 15 seconds, breathing normally. Please don't hold your breath. People do that without noticing. Then slide back up, rest a moment, and repeat 3 times. What's happening here is your thigh muscles are doing isometric work, meaning they're contracting without the joint moving much. That's a fantastic way to build strength around the knee while keeping the actual bending to a minimum. If a few inches feels shaky, that's completely fine. Stability comes before depth, always. Day 3. Standing leg curls. Today we work the back of the leg, the hamstrings, which often get ignored but matter just as much as the quads for keeping a knee stable. Stand behind your chair, holding onto the backrest for balance. Feet hip-width apart. Slowly bend one knee, bringing your heel up toward your backside. Go as far as feels natural. You're not trying to touch your heel to your body, just lift it comfortably. Hold for a second at the top, then lower with control. 10 reps, then switch legs. Here's a small tip that makes a big difference. Keep your standing leg slightly soft, not locked straight. Locking the knee puts unnecessary strain on the joint, and honestly just feels worse over time. A soft, slightly bent standing leg is more stable anyway. By day 3, you might start noticing that your knee feels a bit warmer after these sessions. Not painful hot, just that pleasant, blood-flowing kind of warm. That's a good sign. It means the muscles around the joint are waking up and doing their job. Day 4. Step-ups. Time to add a bit more challenge, but don't worry, we're keeping this manageable. Find the bottom step of a staircase, or if you have one, a very low, sturdy platform, no higher than a standard stair step. Stand in front of it. Step up with one foot, pressing through your heel, then bring the other foot up to meet it. Step back down the same way, leading with the same foot you started with. Repeat 5 times leading with the right leg, then 5 times leading with the left. Hold onto a railing or a wall if you need to. There's zero shame in that. Balance is its own skill, separate from strength, and it's just as important for healthy knees. If you find yourself wobbling, that's actually useful information. It tells you where to focus over time, not a sign you're doing something wrong. This exercise mimics real life more than any other one this week. Stairs, curbs, getting in and out of the car. They all use this exact movement pattern. Practicing it in a low-risk, controlled way trains your knee for the moments that actually matter in your day. Day 5. Seated. Marching back to the chair today, but this one's sneaky effective. Sit tall, feet flat on the floor. Lift one knee up toward your chest as if you're marching in place while seated. Lower it back down, then lift the other leg. Keep alternating for about 30 seconds to a minute, at a pace that feels brisk but controlled, not rushed. This move does something the others haven't touched yet. It works your hip flexors alongside your knee. And honestly, hip mobility and knee health are more connected than most people realize. When your hips are stiff, your knees often end up compensating, twisting slightly to make up for the lack of movement higher up. Loosening the hips takes some of that pressure off. If you want to make it a little more interesting, try adding a gentle arm swing, opposite arm to opposite knee, like a slow motion walk. It won't add difficulty to the knee itself, but it makes the whole thing feel more like real movement, which your brain and body both appreciate. Day 6. Calf raises. We're finishing the strength building portion of the week by looking downward, to your calves. Stand behind your chair again for support. Feet hip width apart. Weight even between both feet. Rise up onto the balls of your feet, lifting your heels as high as comfortably possible. Pause for a second at the top. Lower back down slowly. The lowering part matters just as much as the lift, so don't rush it. Do 12 to 15 reps. You might be wondering what your calves have to do with your knees. Quite a lot, actually. Your calf muscles help absorb shock every time your foot hits the ground, whether you're walking, climbing stairs, or just standing up. Weak calves mean more of that impact travels straight up into the knee joint. Strengthening them is like adding a shock absorber your knee didn't have before. Day 7. Gentle full body flow. For the last day, we're going to string together a few of the movements from the week into one smooth little sequence. A way of reminding your body that all these pieces work together. Do this slowly, no rush at all. Start with 10 seated knee extensions, alternating legs. Move into 3 wall sits, 10 to 15 seconds each. Then 10 standing leg curls per side. Finish with 30 seconds of seated marching to bring your heart rate up just slightly and end on an easy note. Take your time between each part. This isn't about speed or burning through a checklist. It's about noticing how your body feels compared to day 1. Maybe the wall sit feels a little steadier. Maybe your knee doesn't complain quite as loudly when you stand up afterward. Small differences count. They add up. What comes after day 7? Here's the honest truth. 1 week won't fix years of stiffness or wear on a joint, but it can absolutely start something. Consistency is what actually changes how a knee feels over the long run. Not any single miracle exercise, no matter how many videos promise otherwise. What this week does is give your knee a taste of regular movement, a bit of strength it didn't have before, and hopefully a little less fear around using it. If you noticed real improvement, keep going. Repeat the cycle, maybe adding a rep or 2 here and there as it feels right. If something hurt in a sharp wrong way, not the normal, my muscles are working feeling, but actual joint pain, ease off that particular move and consider talking to a physical therapist. They can look at your specific knee, your specific history, and tailor things in a way no general video ever could. And one last thing, because I think it matters, don't measure your progress against anyone else's knees, including the version of your knees from 20 years ago. Just measure this week against last week. That's the whole game. Slow, steady, kind to yourself. That's how knees and honestly most things actually get better.